more specifically what I'm looking for, silence, so if you have the word silence, yeah, but that would be overnight, wouldn't be so red, wouldn't be inflamed. It's just slightly different, but you have to at least consider. So the problem here is it's definitely an inflamed field, so anesthetics, do they work as well in inflamed fields?
No, they don't.
And how come?
Because of the pH.
Yeah, so because the pH drops when it's acidic, lidocaine maintains the ionized form and keeps it. So the freezing doesn't work. And the difficulty of this is just adding more. If we just stem this capsule, and then if you try to do circumferential blocks, while it looks like it just ends here, you may have poor freezing all the way out. So even circumferential blocks don't work as well. So what about incision here? Where do we want to incise this?
Or which direction?
Yeah, like what angles you want to be aware of?
We want to follow the line.
Yeah, generally, so that's one part of it. And so that would be the only part that I would say if you were anywhere else other than the face here. The only thing I'm getting at is here, I'm going to try to be below the angle of the jaw. Because it has a scar, it'll be underneath this chin. So we try to see if we get it from this perspective. This is going to be pain. So I'm going to freeze through this line and see if we get it to drain. But let's say we kind of pop it here, we get to this spot, and see if there's anything that happens. But typically, we should be able to get away as long as you're aware. So we just go through here. So as long as we're cutting on this side, I think we should be fine. So this is our lidocaine here, so I apologize. So what we want to do is, you can see the bevel of the needle right there. That's where we want to be bevel up, because I want to be just barely underneath the skin. So as I said before, I'm going to feel a little poke here. I want it to blanch. Like that. You okay? And this is why people viewing this and other people that procedures are very frustrating. You feel like we're being skimpy with the anesthetic. It's not that at all. It's just that unfortunately with these infected fields, you're caught. You don't want to do the patient more harm than not, and the anesthetic simply just won't work very well in some cases. So it's not as simple as just adding more. And if you've never had anesthetic, you okay? The anesthetic itself is pretty uncomfortable. Now, not compared to you have to do lots of manipulation, but it's something you should always keep in mind when you're doing these procedures. So what causes this to happen? Like, why does he have this? So typically it's just bacteria that's gotten underneath his skin, right? So he may have just scratched his skin, he may have just rubbed it the wrong way, he may have caught his collar or something along those lines. But it just gets underneath the skin and then so once I've done this superficially, I am going to try to put some in the medial space where I'm going to be cutting, because I want to make sure that's frozen, but this will probably go into the capsule itself. You okay there? I can feel it just then. Is that hurting more?
No.
Blanching up through here because I'm into it. That's what I'm saying. You have to be just a little bit careful with that. A little bit over here. So how's that feel when I finish there?
Not really.
7/11 blade. So this is definitely as opposed to an abscess. This is an infected cyst. Give you a copy. I'll tell you when it's posted. Not too uncomfortable? So the other thing we should talk about too is, so he was seen down in the clinic and put on antibiotic. Like at that level, what percentage of the things that look like that were cured with antibiotics? Almost zero. So my point being, and that's just a learning point. If you saw something like that, like this needs to be drained. Like if we don't drain this for him, it's either going to create so much pain that it's going to canalize and drain itself and erupt through his face without him having control over it, or it's going to get worse and worse and systemically have deterioration. So it's going to increase the bloodstream and you can see that you can see. Especially these ones along the face and the head. Yeah. Well, anywhere that's close to the facial brain. So once that's like that, so now we're going to syringe this. So irrigate it. So just do the other side for you. you see big chunks of it, then you should take those out if you can. Just to see if it encourages drainage and less likely to accumulate or accumulate less and less. So generally when we're moving this around, so trying to get all those balls to be affected by it. Does that hurt much when I do that? So these are all the things you want to be aware of. Because it's an infected field, curetting is great, but you can't be too aggressive. You're causing him lots of pain. So you may have to move to either a plastic curette or a Q-tip or something one of those. Even though you have to give, you should always try to do this because the metal is obviously going to be stronger. So it's going to be more likely to break down those. Yeah, which is what we want in the first place. You're tolerating that okay? So after I've irrigated this, and then I'm going to do my swab. So why didn't I swab right at the beginning? So yeah, so pusses are dead cells. And what do we grow when we try to play out dead cells? So this is one of the most common mistakes I see some excellent practitioners making. And it's just because it's not something that's taught as part of your residency. You may not get microbiological training, at least from the lab's perspective. You unfortunately don't overlap enough with that. History or something. That's not hurting too much. So he's just trying to get some of this out. So it's not critical that I get all of this out because it's just not going to be coming out nicely. You okay? Let's see your gate. okay? And so see how he's relatively comfortable with it with some freezing, but when I do this without any freezing in, it's much more uncomfortable. That's why we just don't do this being the first day. I don't know. I can certainly get away with not packing it at all. I find there's a balance here, though. Sometimes you get more bleeding rates and people do this a lot. You'll relate with that to a certain extent. So what will happen essentially is tomorrow we'll take this out, we'll irrigate it a little